Jenny, Emma, Ryan, and Amari.
Tourettes Syndrome is a neurological condition responsible for involuntary movements and sounds called tics. Tourettes Syndrome has been linked to different parts of the brain, like the basal ganglia, which helps control body movements. Damages in this area may affect nerve cells and the chemicals that carry messages between them. Tics can happen randomly, and they may be associated with things such as stress, anxiety, tiredness, excitement, or happiness. They tend to get worse as they are talked upon or focused on.
Tourette's have many symptoms, but most could be overlooked. Many symptoms are blinking, eye rolling, shoulder shrugging, jumping, etc. There's no specific test that can diagnose Tourette's syndrome, and the diagnosis is based on the history of your signs and symptoms. Both motor tics and vocal tics are present, although not necessarily at the same time. Motor tics are like your muscles moving, so like spasms and moving your arms. Vocal tics are sounds utterly unintentionally, and so yelling, cussing, and screaming can be a part of that.
For some background on this disease, we have to travel back to the 19th century, where Gilles de la Tourette published an article that noted his observations of different movement disorders, all of which presented similarly. And though this particular article did not draw the direct link between these movement disorders, or what we now call tics, and one common neurological thread, Tourette is still credited as the discoverer of TS because of this article. But that's not the whole story, because in 1498 a book called Witch's Hair was published, and in this book a priest was described as having symptoms in line with a modern diagnosis of Tourette's. So though Tourette may have been the first scientist to publish about TS, he certainly was not the first to observe its symptoms. Now, when Tourette died, its research into his disease came to a basic standstill until about the back half of the 20th century, when, with the founding of the Tourettes Syndrome Association, the scientific community's interest in this disease was piqued once more.
Because each patient is unique, the individual or family should work with a clinician to determine the appropriate treatment plan. It may take some time and patience to determine the most effective approach. A clinician may recommend first treating some of the co-occurring conditions if it is more bothersome or problematic than the tics. Some medications would be like medications that block dopamine. They're useful to sedate and suppress tics. And some of the therapies include deep brain stimulation, behavior modification, and speech therapy.
While there may be few treatments, not many medical professionals are needed in this field. A clinician or pediatrician may be needed to decide further treatment plan and prescribe medications. As well as behavior, DBS, and speech therapists may be needed to help reduce tics, the severity of tics, and the impact of them. Because Tourette's syndrome is psychiatric as well as neurological disorder, a neurologist can be useful in Tourette's syndrome to diagnose as well as prescribe medications to a patient. The medical professionals are limited due to the few treatments, but the known treatments are extremely helpful.
Despite the discovery of Tourette's tracing back to the 15th century, modern researchers are still coming up with new treatments and innovations. The CDC, for example, provides a significant amount of funding for the screening of Tourette's and different types of tic disorders, specifically in young children. In addition, as recently as June of 2020, scientists at the University of Nottingham have devised a brand new way to treat Tourette's with very promising results. They used repetitive stimulation of the median nerve at the wrist to create rhythmic electrical brain activity. The study consisted of 19 people and showed that the experiment reduced tics and the urge to tic, especially in extreme cases of Tourette's. Because of how multifaceted Tourette's is and other neurological disorders are, they require teams of people with very different skill sets and backgrounds in order to effectively develop treatments. This is why multinational cooperation on research and development is specifically key, especially in the case of Tourette's. Cures and treatments cannot be achieved by one person or one nation alone. Only when we work together can we invent treatments for some of the most complicated ailments, just like Tourette's.